Paying for care. Long-term care can range from assistance with daily routines on a part-time schedule to 24-hour care with medical assistance. Families need to know the approximate costs associated with each level of care in order to determine what is affordable with current asset and income. This information should assist families with making informed choices when considering the purchase of policies and other financial products to pay for future long-term care expenses. Who is most likely to need different levels of care cannot be determined, but knowledge of average for length of stay, factors such as gender and family health history can help with projections for the kind of care that may be needed. This information was found on the U.S. Department of Health and Human Services long-term care site. The average annual cost in 2012 for nursing home care in the state of Iowa was $46,412. Projected annual cost for 2037 is $56,056, based on current trends in health care and the impact of inflation. The monthly cost listed represents non-metro areas of the state. Individuals should consider both costs when making decisions about extended care. The policy benefits for long-term care are based on location. An individual who purchases a policy in a state with a higher cost can enter a nursing home or assisted living facility in Iowa could potentially receive benefits that exceed costs. The extra funds may be subject to income tax. Some early long-term care policies result in this added benefit, but subsequent underwriting changes have diminished the likelihood that this will occur with new policies. An individual could have the reverse situation where benefits are lower than the actual costs if they relocate to a more expensive state. This would all depend on the language of the policy. Alternate care often allows an individual to remain in their home. It can also be an option that is more likely to be coupled with unpaid assistance provided by family members. The national figures are based on data from 2010. The Iowa costs are for 2012. One could assume that the Iowa costs are higher due to the impact of inflation. The services listed may or may not be available in rural areas of the state. Before looking at methods of paying for long-term care, an individual should be aware of the average length of time an individual is likely to be using these services. While it is hard to predict that any one person will be average, this data can help a family determine if sufficient assets are available and if additional assistance, insurance for example, will be needed. Age is the most obvious reason individuals will need some kind of assistance with daily routine or medical care. Women live on average 5 years longer than men, resulting in a greater risk of needing assistance. Couples have a greater capacity to provide care for each other. Health status can include individual risk factors, employment history, lifestyle choices, and medical histories, as well as family risk factors. To find state-specific costs or to find more current data related to the costs associated with long-term care, the website maintained by the U.S. Department of Health and Human Services will provide reliable information.